Welcome to S.A.Y. This is Amy. Hi, Amy.
Here. My name's Amy Georgeadis, and I am a speech language pathologist and the program director at the Stroke Comeback Center.
What is live participation speech therapy? Or what is between the traditional outpatient speech therapy and live participation therapy?
Yeah, this is so interesting because I worked in acute rehab for so long. I really wasn't exposed to the life participation approach until I came to the Comeback Center. But traditional therapy is, the speech therapist is setting goals for the patient based on, what we want them to do. And we try to meet those goals, and we take data and we measure progress. And we do a lot of testing. And certainly the patient or the client at that time has a say in what goals they're working on. But it's very, very prescriptive. And you're always just looking to make progress based on testing, based on performance. The life participation approach is something much broader, where it's really a member-driven focus, where everything is really about the person who has aphasia and what they want. And we're not looking at testing or measuring progress through better performance on tests or scores on things. We're looking at the members' personal feelings about how they are doing in life. And so it's not these specific goals like you will say these 10 words with 80% accuracy. It's do you feel like you're able to participate in your life better? To me, it's much more about quality of life. And, if you're not happy with where you are in a certain area, what is it? Is it writing that you want to work on? Well, then let's work on your writing. And what can we do to help you get better at it? And then you tell me if it's working, if you feel like you're getting better at it. You tell me if coming to the center is helpful because you're enjoying it and you're making communication progress and you're meeting people and you're getting access to resources about stroke survivors. So it's a much more broader brush of getting better and participating in life more.
My friends have aphasia, but his words are not clear. Why is that?
Yeah, so not everyone who has a stroke or a brain trauma has aphasia. They may have something else going on from their stroke. There's something called Dysarthria, which is really a motor speech problem, where people go to speak, but they have weakness or incoordination, and they may not speak clearly from that. So a lot of people who have aphasia get a double whammy, and they may have aphasia and dysarthria. So, there's plenty of people who have aphasia whose speech sounds perfectly clear, but they have difficulty with their language. But if somebody's speech isn't clear, it's usually because they have something else going on, usually either dysarthria or apraxia with that aphasia.
What do you suggest the clear sound?
Yeah, there's different techniques for dysarthria treatment. And usually it's helping train the person to use some strategies to make their speech sound clearer. So, the speech sound can break down as far as the level of respiration, where they're not getting enough breath behind their speech. It could be a vocal cords issue. And then usually we see weakness in the mouth, just like sometimes after a stroke, someone's weak on one side of their body.
Yes.
they can be weak on one side of their mouth. So the sounds don't come out as clearly. So we tend to work with those people on using strategies like taking big breaths, really trying to speak louder, over articulating, where they're really trying to overdo their speech sounds to compensate for the weakness.
For example, my friends said, I went the Banana Republic, but he said, I went to Banana Republic. He is frustrated too. I want to say Banana Republic, but I said Banana Republic.
Right. So it's just a lot of training and practice and breaking down long words, like republic, into let's just focus on saying each syllable.
Yeah.
Maybe you tap while you do it. Republic, where there's just a much more emphasis on the treatment of the speech piece.
Yeah, and I said just slower, not faster.
Yeah, I think that's another great strategy, often just slowing down or separating words by syllables to really slow yourselves down. But like anything, it's so hard to do because all of us are used to talking a certain way. So to change your behavior and how you're communicating, whether it be for aphasia treatment or dysarthria treatment, it takes a lot of work. It doesn't come automatically.